welcome back to the Deep Dive. Today we're tackling something, well, honestly, really frustrating that almost everyone bumps into. Why do your fingernails just constantly break or split or peel? Like they're made of the cheapest plastic imaginable. You might think, oh, it's simple, I just need some hand cream. But we've dug into the sources you sent, and they paint a much more complex picture. Nail failure seems deeply linked to our biology and our daily routines.
That's absolutely right. For this deep dive, we're really focusing on what the medical folks call brittle nail syndrome, or BNS for short, and also the slightly more worrying thing called onycholysis.
Onycholysis, that sounds serious.
It can be. It's the clinical term for when the nail actually starts lifting off, detaching from the nail bed underneath. And our sources, they're very clear. Keeping your nails strong isn't simple. It's this constant push and pull between, environmental attacks and what's going on inside your body.
Okay, so our mission today is to really give you that full picture, right? We're going beyond just use moisturizer and diving into some maybe surprising biological factors, the systemic stuff. Because look, you can't fix a chronic nail problem unless you figure out both the external things.
The exogenous factors, yeah.
Right, the assaults from outside.
Yeah.
And the endogenous signals, what your body's trying to tell you from the inside.
Exactly. And think about this. Your nail isn't just a hard little shield. It's almost like a living diary of your internal health, specifically for the last, say, 6 months. It's an incredible diagnostic tool if you know how to read it.
Okay, let's unpack that. Part 1, understanding the nail unit. Before we talk about failure, we need to know how nails are actually built. They're not just dead bits, are they? They're specialized skin appendages, mostly hardened protein keratin.
Right. And that keratin, it's not just one solid block, it's layered, kind of like microscopic plywood. And the strength of the whole thing really depends on the stuff between those layers. The sources we looked at really emphasize this crucial lipid content. Think of it as intercellular cement.
Oh, I like that. Like the grout between tiles. If the grout wears away, the tiles get loose and can pop off.
Precisely. Strip the grout, the structure fails. And this whole building process, it starts in what you could call the engine room, the nail matrix.
The matrix, that's the bit under the skin at the base.
Exactly. It's the growth center, the root that's tucked away under the skin, protected by the cuticle. Its job is basically churning out all the keratin cells that form the nail plate itself. And what's really key here is how sensitive that matrix is.
And that sensitivity, it translates directly into the quality of the nail being produced.
It really does. Any significant damage or inflammation or even just a shock to the system affecting the matrix. Think like a really high fever, chronic stress, maybe slamming your finger in a door. Yeah, it directly impacts the quality, the thickness, even the texture of the nail that grows out afterwards. It's like the matrix is keeping score, recording everything.
Which brings us to that really mind-bending fact you mentioned earlier, the historical record.
Yes. Okay, so the average fingernail grows about, let's say, 3 to 3.5 millimeters a month.
Okay.
So if you just do the quick math, the nail plate you can see right now, especially the tip, it's basically a physical history of your matrix's health and, well, your body's nutritional status over the last 6 months.
Wow. So if you were really sick 6 months ago,
you might literally see a line or a ridge marking that event as it grows out towards the tip today. It's fascinating.
That totally reframes how you look at your nails.
Yeah.
They're like a slow motion timeline on your fingertips. Okay, and we should also quickly mention the protective seals, right? They're important too.
Oh, absolutely critical.
Yeah.
You've got the cuticle, which seals off that nail matrix area, keeping bacteria and water from getting down to the root. And then there's the hyponychium, that's the tight seal right under the very tip of your nail. It stops germs and gunk from getting into that space between the nail and the skin underneath. If you damage those seals, you're basically opening the door for trouble.
Got it. Okay, part 2, defining the failure. So we know how it's built. Now let's talk about the specific ways it breaks down, because just saying my nails are breaking doesn't really cut it, does it? We need to differentiate the types of damage the sources talk about to really zero in on the cause.
Absolutely. This distinction is so important because how you fix it totally depends on how it's failing. Now, the most common type of brittle nail, what most people probably mean when they say their nails are peeling, that's onychoschitzia. Or, lamellar dystrophy.
Well, like layers.
Exactly like layers. This is that horizontal splitting, the layering effect right at the free edge of the nail, it looks like the layers of paper peeling apart at the edge.
Okay, the classic peeling tip.
That's the one. And this overwhelmingly points towards external factors damaging that lipid cement we talked about.
Okay, horizontal peeling equals external damage, mostly. What about vertical splits? Those feel like they go deeper and they can be really painful.
They often are. That's onychorexis. Think vertical ridges or grooves running the length of the nail, from the base right out to the tip, and sometimes splitting along those lines. This is usually less about surface peeling and more about a structural issue starting back in the matrix. Could be damage there, or sometimes just how your nails naturally grow. It points to a deeper issue in the production line, so to speak.
Right. And then the really worrying one you mentioned earlier, detachment.
That's onycholysis. And this is when the nail plate, usually without any injury causing it, starts separating from the nail bed underneath. It typically starts at the far edge, the tip, and works its way back.
And the detached bit looks different.
Yes, it looks white or maybe yellowish, opaque, because there's air trapped underneath where it's lifted off. This is a big red flag. It really needs checking out because it's often linked to things like fungal infections, maybe underlying skin conditions like psoriasis, or sometimes even systemic health problems.
Okay, so quick recap. Peeling at the tips is probably external stuff like water or chemicals. Vertical splits suggest a matrix issue or maybe trauma. And that lifting, detachment that signals potential infection or maybe a bigger health issue brewing. That's actually a really useful mental checklist for listeners.
Definitely. Now let's pivot to those external assaults, part 3. Exogenous causes. These are by far the most frequent culprits for brittle nails. And if you remember just one thing about habits, it should be this. The main environmental enemy of your nail isn't just being dry, it's the cycle of getting wet and then drying out over and over again.
Ah, right, the hydration cycle trap. Explain that. How does just doing the dishes manage to wreck your nails?
Okay, think of it like mechanical stress. Your nail plate isn't totally waterproof, it's semi-permeable. So when you soak your hands, washing dishes, swimming, even just frequent hand washing.
Which we all do now.
Exactly. The nail absorbs water and it can actually swell up by like 30%. Then when your hands dry out, the nail contracts back down. Now imagine doing that multiple times a day.
That constant expanding and contracting.
It physically fatigues the keratin layers. It stretches and weakens those crucial lipid bonds holding the layers together. This mechanical fatigue is the #1 cause of onychoschitzia, that horizontal peeling at the tips.
Wow, so it's not the water itself, but the physical gymnastics the nail is forced through. And then, of course, we often add harsh chemicals to the mix.
Oh, absolutely. Things like strong soaps, detergents, bleach, anything really alkaline. These chemicals directly attack and degrade the keratin protein itself. Plus, they strip away any natural oils left on the surface that might offer some protection against that water absorption. It's like a double whammy.
Brutal. Okay, what about physical abuse? And I think we're all guilty here. Using our nails as little tools, right, to scrape off a label or pry something open.
That kind of micro-trauma is sneaky because the damage builds up over time. Using nails to scrape or pry, even just typing really hard and hitting the keys aggressively, it creates tiny invisible fractures that weaken the nail. And the sources also highlighted something very specific about manicures. Technique matters. A lot of us, myself included, probably file our nails using a back and forth seesaw motion.
Yeah, it's standard practice, right?
Well, it turns out that action physically shreds the very fine keratin layers at the edge. It directly leads to fraying, peeling, splitting right at the tip. The correct way. Heil gently and only in one direction.
One direction only. That's a massive takeaway right there. Okay, but we have to talk about the elephant in the nail salon. Cosmetic treatments, gels, acrylics.
They look great, but what's the cost? The cost to the underlying nail structure can be pretty significant. Think about the process for gels or acrylics. It often involves first roughing up the nail surface, either chemically etching it or physically sanding it down so the product sticks better.
Right, creating grip.
Then there's the curing, usually under UV or LED light, which itself might cause some microdamage. And finally, the removal process. That's often a long soak and cure acetone, a really harsh solvent, or more aggressive mechanical filing or scraping to get the old product off.
Okay, wait, so you've got chemical etching, light exposure, then harsh solvents or scraping. That combination basically obliterates that lipid structure we talked about earlier, doesn't it?
Pretty much, yeah. That repeated cycle of application and harsh removal leads to significant thinning, weakening, and dehydration of the natural nail plate. Dermatologists even have a term for it: post-gel nail dystrophy.
Wow. And then there's that weird paradox with some nail hardeners, the ones with formaldehyde.
The hardener paradox, yes. They work by creating extra chemical bonds, cross-linking the keratin, which makes the nail feel incredibly hard, rock solid.
Which sounds good.
But in making it so rigid, you sacrifice all its natural flexibility. A healthy nail has a little give, it can bend slightly under pressure. A nail treated with these strong hardeners, it loses that flex, so instead of bending, it just shatters. You end up with these sudden, really severe breaks instead of gradual wear and tear.
So harder isn't always stronger. And don't forget nail polish remover itself, especially acetone.
Acetone is a powerful solvent. I mean, its job is to dissolve things like nail polish and adhesives. So, unsurprisingly, it's incredibly effective at stripping every last bit of natural oil and moisture from your nail plate and the surrounding skin. Very dehydrating.
Okay, that covers the external attacks pretty well. Let's move inside the body now, part 4. Endogenous causes the internal health check.
Right, and if we connect this back to the big picture, the endogenous causes, this is where nail problems can sometimes be a signal flare for more significant health issues. These internal factors affect the nail matrix's ability to build a strong, healthy nail right from the start.
So the problem isn't damage from the outside hitting the finished product. It's like the raw materials being supplied to the nail factory are faulty or insufficient.
That's a great way to put it. The matrix is constantly producing new cells. It's a high turnover area, so it needs a consistent, high-quality supply of nutrients. Keratin itself is a protein, so not getting enough protein in your diet, especially specific building blocks like the amino acid cysteine, that directly impacts nail structure. But the real star of the nutritional research when it comes to nails is biotin.
Right, biotin. You hear about it all the time for hair and nails. But I've also heard people say it's just hype, a gimmick. What did the actual clinical sources say specifically about, like, dosage and whether it really works?
That's a really important point. The gimmick perception often comes from studies using low, sort of maintenance level doses, or from people just taking a standard multivitamin amount. However, the sources point to several well-conducted, double-blind, placebo-controlled trials.
The gold standard.
Exactly. And these studies showed significant improvements, but specifically with high-dose biotin supplementation. We're talking 2.5 to 5 milligrams per day, which is way more than you get in most multivitamins.
Okay, 2.5 to 5 milligrams.
Yeah. For people diagnosed with actual brittle nail syndrome, that higher dose has been clinically shown to significantly increase nail thickness and hardness and reduce that splitting and peeling. It seems to work by helping stabilize keratin synthesis. So it's not a magic bullet for everyone with weak nails, but for true BNS, the evidence for high-dose biotin is pretty solid.
Interesting. So dose really matters there. And what about minerals? Can deficiencies actually change the shape of your nails?
Oh, definitely. Iron deficiency is a classic one. Even if you're not fully anemic, low iron is a well-known cause of brittle nails. And in severe chronic cases, it can lead to something called koilonychia.
Koilonychia.
Yeah, it's very distinctive spoon-shaped nails. The nail plate actually becomes concave, dipping inwards like the bowl of a spoon.
Wow.
Then there's zinc. Zinc is crucial for cell division, which is happening like crazy in the nail matrix. So a zinc deficiency can slow things down or disrupt the process, sometimes showing up as Bowes lines.
Bowes lines. Those are the horizontal ridges.
Exactly. Horizontal grooves or depressions that run across the width of the nail plate. They basically mark a time when the matrix temporarily slowed down or stopped normal growth, often due to illness, high stress, or, yes, a nutritional deficiency like zinc.
So nails really do tell a story.
Okay.
Beyond diet, let's talk about systemic diseases. How can nails reflect what's happening in the rest of the body?
The link between thyroid function and nails is probably one of the most well-known. Hypothyroidism, meaning an underactive thyroid, that often causes nails to grow very slowly, become dull, brittle, and maybe thicker.
Right.
Conversely, hyperthyroidism, an overactive thyroid where everything's sped up, that can sometimes cause onycholysis, the nail separating from the bed. That specific type is sometimes called plumber's nails.
Fascinating. What about blood flow? Does circulation matter?
Hugely. Poor peripheral circulation, like you might see in conditions such as Raynaud's phenomenon, where fingers get really cold and blood flow is restricted, that effectively starves the nail matrix of the oxygen and nutrients it needs to function properly.
Oh, okay.
If the matrix isn't getting that steady supply, the nail plate it produces is likely to be thin, brittle, and grow very slowly.
Makes sense. And finally, what about skin conditions or even medications?
Right, we have to consider dermatological issues. Nail psoriasis is a big one. it doesn't just affect the skin, it can cause pitting in the nails, like tiny dents or yellowish oil spots under the nail, thickening and crumbling. And fungal infections, onychomycosis, they're physically destructive. The fungus literally eats the keratin, leading to thick, discolored, crumbly nails that often separate from the bed. And on the medication side, certain drugs are known to be tough on nails because they affect rapidly dividing cells, which includes the nail matrix. Chemotherapy drugs are a major example. High-dose retinoids, sometimes used for acne or psoriasis, can also cause issues, even some antibiotics. In severe cases, these drugs can disrupt growth so much they cause onychomadesis, the complete shedding of one or more nails.
Okay, so clearly a lot can be going on. Part 5. Diagnosis and management. Given this huge range of possible causes, from simple water damage to serious illness, what are the definite red flags? When should someone stop trying home remedies and actually see a doctor or dermatologist?
Yeah, knowing when to seek professional help is key. The major red flags are experiencing pain in or around the nail, seeing any pus or signs of infection, significant swelling, any sudden or persistent change in the nail's color or shape, like that spooning or new dark streaks, or, and this is important, if the problem is affecting multiple nails at once and just isn't getting better after a few months of trying basic care.
That persistence, especially across multiple nails, really points towards something internal, doesn't it?
It strongly suggests an endogenous cause rather than just external damage, yes.
So if you do go to the clinic, what's the diagnostic process usually like?
Well, it always starts with a detailed history. Your doctor will ask about your job, your hobbies, your cleaning habits, any chemicals you handle, what cosmetics you use, medications, supplements, family history of nail or skin issues, all of that.
Getting the full picture.
Exactly. Then, if they suspect an internal cause based on your symptoms and history, they'll likely order blood tests. Usually a complete blood count, or CBC, to check for anemia and iron levels, TSH to check your thyroid function, and maybe tests for specific vitamin or mineral levels like zinc, or even autoimmune markers if needed.
And if they suspect fungus.
If there's signs of infection, like that detachment or discoloration, they'll often take a small clipping or scraping of the nail or the debris underneath. That gets sent off for a mycological culture or other tests to identify the specific type of fungus involved. That's crucial because different fungi respond to different treatments. And antifungal treatment, especially pills, can be long and needs monitoring.
Right. Okay, let's get practical. Regardless of the underlying cause, what are the universal foundational things everyone can do starting today to prevent nail damage or help them recover?
Number 1, absolutely top priority, protection. Specifically, protect your nails from that wet-dry cycle we talked about. That means wearing gloves.
Every time.
Ideally, yes, for all wet work. Washing dishes, cleaning with detergents, washing the car, even prolonged food prep if your hands are getting wet. Use waterproof gloves like vinyl or nitrile. Sometimes wearing thin cotton liners inside can make them more comfortable. And don't forget gloves for dry, dirty work too, like gardening or DIY projects to prevent physical trauma and those micro cracks.
Okay, rule 1, glove up. What's next?
Rule 2. Moisturize, moisturize, moisturize. After your hands have been in water, and especially at bedtime, apply a good quality moisturizer. A thick emollient hand cream is good, but even better for nails is a specific nail oil or balm. Look for ingredients rich in lipids like jojoba oil, vitamin E, or even things like lanolin or phospholipids. Massage it into the nail plate and the cuticle area to help replenish that cement that water and soap strip away. Consistency here is absolutely key.
Stop the damage, replenish the good stuff. Got it. And finally, those manicure adjustments we touched on earlier. How to handle nails without causing more damage.
Right. Keep nails trimmed reasonably short if they're prone to breaking or peeling. Shorter nails have less leverage to catch and break. Smooth any snags immediately. And remember the filing rule. Use a fine grit file, and always file in one direction only, moving from the side towards the center. No more back and forth sawing.
One direction. Burn it into memory.
And be gentle with your cuticles. Avoid cutting them or pushing them back too aggressively. That cuticle is the nail's natural protective seal for the matrix. Damaging it opens the door to infection and can affect growth.
Excellent practical advice. Okay, let's wrap this up.
Sounds good. So to synthesize this deep dive, I think the main takeaway is this: breaking, splitting, peeling, detaching. These aren't really diagnoses in themselves, they're symptoms. Symptoms of an underlying imbalance. And that imbalance could be something as simple and fixable as, too much wet work without gloves, or it could be a sign of something more complex like thyroid issues, a nutritional deficiency, or even an autoimmune condition. Figuring out the why is crucial, and that often requires looking closely at both your daily habits and your overall health.
Well said. And that really leads us perfectly into our final thought for you today. Remember that fact about the nail play being a 6-month historical record of what's been going on with your body and your environment. So take a look at your nails right now. Consider what story they might actually be telling you about the last half year. Are you seeing signs of stress you went through? A period of poor nutrition? Maybe the effects of starting a new medication or a new cleaning routine? Thinking about your nails this way, it allows you to use them almost like a subtle biological calendar, a way to monitor your well-being and maybe catch imbalances early, giving your body what it needs before a small issue becomes a bigger problem.